Hi, my name is Lindsay Dye. I'm a nursing student at the University of South Alabama, and today I will be performing the IV insertion saline lock checkoff. And we'll scan the room. So first, I'm going to verify my order and verify hospital policy. So I have an order for insert saline lock NAM for CT scan. I'm going to perform hand hygiene and identify my patient. So we have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. He has an allergy to penicillin and he's wearing his armband for an allergy to penicillin, and there are no other allergies noted. I will provide my patient with privacy and explain the procedure to him and gather all of my equipment, and I have all of my tape prepared already. And so now I need to position my trash can. I'm going to perform hand hygiene and I'm going to apply my goggles. And then I'm going to raise my patient's bed to a working height. I'm going to lower the side rails and I'll place my patient in a comfortable position, either supine or sitting, while maintaining privacy. And so now I'm going to open all of my packaging using aseptic technique. And so now I need to clean the cap of the saline lock. And so I'm going to get my alcohol swab and I'm going to clean it for 15 seconds. And then I'm going to get my flush, remove the lid, and twist it on. And I'm going to prime my tubing, and then loosen the cap, and then place it back in its packaging. And then I'm going to move my tegaderm and over the needle catheter close to my patient. And so now I need to identify 3 ways to pick a vein. And so it needs to be on the non-dominant arm, it needs to be a distal large spongy vein, and you need to avoid areas of bruising. And then to foster vein distension, you can apply a warm compress for vasodilation. You can put the arm in a dependent position or lightly stroke the patient's vein. And so now what I need to do is apply the tourniquet 4 to 6 inches above the insertion site. And I'm going to use the quick release knot. And so now I'm going to assess the patient's radial pulse, and I'm going to check the appropriateness of the vein. And I'm going to put on a clean pair of gloves. And then I'm going to move my saline lock close to the patient. And so now I'm going to get my chlorhexidine and activate it. And then I'm going to vigorously clean the site for 30 seconds, moving in vertical, horizontal, and circular motions. And I will throw that away. And I will need to allow it to dry. And now I'm going to anchor the vein 1.5 to 2 inches below the insertion site, and I'm going to remove the cap off of my needle, and I will instruct the patient that there will be a small stick but to remain still. And so now I'm going to insert my needle bevel up at 10 to 30 degrees and watch for blood return. When I see blood return, I will lower the needle and insert it another 1/4 of an inch. And then I'm going to push the catheter, continue the catheter to the hub while not inserting the needle. And so now I'm going to secure my catheter and pop the tourniquet. And now I need to apply pressure 1 1/4 inch above the site of insertion over the vein. And I will remove the needle, place it in the sharps container. Now I'm going to get my saline lock while still applying pressure and remove the cap. And then I'm going to twist it on. And then apply a temporary piece of tape to the tubing. And then I can release the pressure, and I'm going to reassess for blood return by aspirating for blood contents, and then I will flush the vein with the remainder of the saline in the tubing. And then as I do so, I'm going to be observing for any swelling in the arm, and then I can remove the saline lock and put that in my sharps container. And so now I'm going to place the tegaderm being sure that it's stuck and all the edges are down. And now I'm going to remove the paper portion and save it for later because of the label. Make sure all the edges are down, and I'm going to set that aside for later. And now I'm going to remove the temporary tape. And allow the tubing to rest in its natural position and tape it in a natural position. And so now I am going to remove my gloves and get my label. And on the label, I'm going to write the time, the date, the gauge of the needle, and initial. And then I'm going to place the label on the edge of the tegaderm, being sure not to go on the insertion site. And so it is on the edge. And then I am going to throw away all of my trash. And then I am going to lower my patient's bed. I am going to raise the side rails. I'm going to place my patient in a comfortable position with the call light in reach, and I'm going to explain to my patients how to prevent dislodging of the IV and signs and symptoms of any complications. So I'll teach of signs and symptoms of infiltration, phlebitis, and inflammation. I will teach my patient to notify a nurse if there's any blood in the tubing or on the drainage, and I will instruct my patient to tell a nurse if there's any slowing down or stop in the flow, if they're receiving fluids. And then I will teach my patient to be careful when moving around with the arm that the IV is on, and to cover it before showering. And so now I'm going to perform hand hygiene, and then I will return to the nurse's station to document, and I'm going to document the date, the time. I'm going to document the describe the location of the site. I'm going to document how many attempts were used, and I will document the size or the gauge and length of the catheter. I will document the patient's response, how they tolerated the procedure. I will document the presence of a saline lock and the flow rate and method if fluids were prescribed. And then now to discontinue the IV, I will enter the patient's room, I will perform hand hygiene, and I will verify the order, identify my patient. I will put on a pair of goggles, which I already have on. I will need to put on a clean pair of gloves. And I am going to remove the tegaderm going towards the site of insertion. And then I'm going to remove the temporary piece of tape. And then I'm going to grab a piece of gauze and place it slightly above the insertion, or slightly above the catheter. And I'm going to gently and slowly pull the catheter out, keeping it parallel to the skin and the vein. And then I'm going to assess the intactness of the tip of the catheter and place it in my sharps. And then I'm going to observe the area for any pain, swelling, discharge, redness, or bleeding, and I'm going to hold pressure onto the site for at least 30 seconds or until bleeding stops. And then I'm going to get my tape and place it over the gauze at the insertion site. And then I'm going to remove my gloves. I'm going to place the patient back in a comfortable position with the call light in reach. I am going to perform hand hygiene and then go to document.